Okay, guys. Today I thought I should explain what kind of teaching profile is required to effectively deliver OET coaching. OET, as we all know, is expanded as Occupational English Test. Please note, Occupational English is completely different from General English. Is the kind of English that is required to perform in a specific role in a specific profession. For example, OET for doctors is a kind of test which would test the English skills required for a doctor in his professional working context. In other words, when he interacts with a patient, with a nurse, with a radiologist, with a pharmacist. So this is a combination of English skills with the ability to comprehend and explain medical terms in a way that is easy for the patient and for other professionals who are associated with him. OET for a radiologist, OET for a nurse, OET for a pharmacist are all specialized English speaking skills which are focused on the professional context. Unfortunately, what happens in our country is that generally English teachers and sometimes nurses try to handle classes for OET, for all professionals. This is indeed an insufficient kind of academic background to teach professionals. For example, to deliver OET coaching for doctors, it has to be essentially a doctor with an international exposure. To teach OET for nurses, the best person again is a doctor with international exposure. I'll try and explain why. See, generally, let's take OET speaking for example. A patient who has been diagnosed with pancreatic carcinoma is trying to find out from the nurse if chemotherapy is safe. This is a context where the nurse will have to put difficult, complex medical terms in a manner which is comprehensible for the patient. For example, the first question here is, what is pancreatic carcinoma? So the nurse should explain, pancreas is an organ concerned with production of insulin which regulates sugar. And carcinoma is a cancer which is likely to spread to other organs through the bloodstream. So one must be careful. One must undergo chemotherapy or radiation to make sure that this cancer does not spread to other organs and become life-threatening. She may have to explain what is chemotherapy. Chemo simply stands for chemicals and therapy stands for treatment. She will have to explain what are the chemicals used. The patient may be worried whether it has serious after effects and side effects. So the nurse needs to be aware of the various chemotherapeutic agents, their after effects and side effects, and she needs to explain them thoroughly to the patient. Now imagine a general English teacher, someone with an MA in English teaching, OET speaking. It would go completely waste. Even a nurse may not be sufficient because here it involves explanation of some medical terms which can be done better by a doctor. So ideally, OET coaching for nurses and doctors should be done by doctors with international exposure to an international organizational context. So that's why I would like to invite OET aspirants to the Cambridge Box Hill Center. Here, OET coaching is done by doctors who have also handled Cambridge English classes effectively for audiences worldwide. So that's the only way to get a B, at least. In the Cambridge Box Hill Center, we do not aim at B. B is enough for a placement anywhere in the world, but we never focus on B. Our idea is to put people at A, at least for speaking and writing, if not for reading and listening. So please note, only a doctor with exposure to an international institutional context can handle OET classes effectively and deliver good results, at least B, and if possible A. So make sure that you choose an OET center where doctors teach. Thank you very much.